More now on one of the big stories developing over the last week or so. A host of companies, from popular restaurant chains to auto parts manufacturers to makers of vital medical devices, warning of cutbacks and layoffs. Most of them are saying they're trying to adapt to the president's health care law while still staying profitable. Scott Adams, Vice President of Distribution at MDSI, the publisher of two publications which follow the healthcare and medical supply industries. And this group is facing a special challenge. Scott, thanks so much for joining us.
Thanks for having me, Shannon. Good to see you.
What we know is that there are 20-some taxes tied to Obamacare that were tucked into the bill. One of those concerns medical device manufacturers, a 2.3% on total sales, regardless of whether they have a profit or not. What are you hearing from folks in the industry about how this is going to impact them?
Yeah, that's exactly right. The issue is the 2.3% tax that the Affordable Care Act is implementing is on revenues at the top line. So that's going to affect manufacturers' profitability on the bottom line, which will absolutely cause them to have to start either one of three things: creating layoffs and moving jobs overseas. Two would be to sorry, lost my train of thought there, Shannon.
Well, that one right there is scary enough.
That's the main issue right there. But the second piece is that they will start cutting R&D, which means long-term, as a society, we start losing wonderful products that come to market from these companies as they start to have to pay this tax. And then the last thing would be, which none of us want, is they would have to pass that pricing on to the consumer, meaning the hospitals and the integrated healthcare delivery networks in our industry.
And when we were told that one of the goals about this was to make healthcare more accessible and to make it more affordable, it sounds like when you factor in this kind of tax, which looking at one analysis, when you add all the different taxes that a medical device company would face, they could be facing a 50% or higher tax rate, essentially, in effect. That doesn't sound like it's going to make it easier for Americans to have better access to these devices that in many cases are life-saving things that folks are going to need.
That's exactly right. The problem with it is, folks, I think here 2.3%, it's not that big of a deal on a healthcare company. They make a lot of money. The fact of the matter is it's 2.3%. So if you take a $100 million company, for example, and you tax them at 2.3%, that's $2.3 million that company will be taxed. Most of those companies are operating on a 3 to 5% profit at the end of the day. So you just took a 2.3 tax on revenue and turn it into a 40 to 60% tax on profit. They don't have a choice but to start laying folks off, moving jobs overseas, cutting R&D. Those are the things that are going to happen due to this tax, and they're unintended consequences, but that's what happens when you just do a full-blown tax across the board without going in and looking at these different medical manufacturers and what they do and the types of profit margins they're really operating on.
And I know that folks within the industry have been trying to sound the alarm ever since the law was passed and it trickled out and everybody was able to see where these different funding sources and taxes were going to wind up hurting folks. You mentioned R&D, research and development. I mean, that's key in this particular industry because we have to keep up. We have to be advancing and doing better. I mean, America has been a leader in medical care. Are we going to lose position? Is it possible because of this tax?
Yeah, absolutely. There's no doubt about that. With what this tax does, it ultimately puts the U.S. medical manufacturers in a position that will be taxed higher than roughly every other country in the world. I'll give you a great real-world example. There's a wonderful company in Skaneateles, New York, Welch Allyn. They've been around since 1915. About a month and a half ago, as we're starting to find out what this tax really means to us in the healthcare world, Welch Allyn had to announce for the first time in its history they'll be laying off 275 employees. This is a company that brings products to us on a daily basis. They have a wonderful R&D department that today, under this, if this tax doesn't get repealed, and let me just say this is on both sides of the aisle, the Democratic and Republican side of the aisle, folks do not want this tax implemented. It will set us back significantly in the healthcare arena.
All right, thanks, Scott, so much for bringing this to light. We appreciate your time.
Absolutely. Thank you, Shannon.